When I went to medical school, they said the great imitator was syphilis, and they used to talk about tertiary syphilis. I think the great imitator today is Lyme disease, because syphilis, we still see some cases, but not like it used to be. So the great imitator disease, and it's very similar in many ways, happens to be Lyme disease. Is that correct?
He who knows Lyme knows medicine. Lyme can imitate over 300 other diseases, and it is a clinical diagnosis, not a diagnosis based on lab tests. Some of the way that I diagnose it is usually it's a multi-systemic disease involving the musculoskeletal system, the neurological system, psychological involvement.
So the first way to make a diagnosis of Lyme disease is what you're taught in medical school, good history taking.
85% of the history of the diagnosis, 85% of the diagnosis can be made by taking the time to get a history and not necessarily even ordering lab tests.
So a lab test should be more to confirm a diagnosis than making a diagnosis.
The lab test that I like to use in patients with Lyme and their co-infections is the CD57, which is an immune system test. And if these immune system cells are down and depressed after treatment, that may tell you that you still have a Lyme infection, like a chronic Lyme infection. That may help guide your therapy because you'll treat them perhaps using a different antibiotic until their immune system comes back and you see these cells rising.